All right, so we're looking at what is known as limited abduction. Limited abduction. Of course, abduction have to do with you're trying to bring your body parts together. Like, let me say, if I want to comb my hair, this is abduction of the hand. If I want to bring my legs together, that's abduction. So if this is limited, of course, it is now trying to tell you that there's a problem. The patient has a problem underneath. You understand? So it just refers to what? Reduced ability to be able to move a limb. Okay? Move a limb. Okay, sorry. Abduction is like moving it away. Okay, sorry. It's adduction that is moving it towards the midline. Okay? So sorry, I made a switch. So this is depending on the joint involved. It could be the hip joint, it could be the what? Shoulder joint, it could be fingers. You understand? Because limited abduction is just a general, you understand? It's not talking about a specific problem. So common types of joints that could have abduction issues. You could have the hip joint having issues. So difficulties in trying to spread the legs apart. You could have the shoulder joint also having these issues. You could have the fingers also having these issues, you know. So this is limited abduction of the leg, all right? Mostly seen in infants that have issues with their hip joints. So general causes, you have muscle weakness or tightness, joint inflammation or degeneration, neurological conditions like stroke, structural abnormalities like, you know, congenital dysplasia of the hip, like I was talking about. Maybe after surgery, you're having some stiffness or trauma. So what to look out for? If somebody has these issues, what will you actually look out for? So pain or stiffness, you know, during movement, asymmetry in the limb. So the limb, you know, how will I say it? The height is not the same thing, you know. Gait changes, weakness or instability, clicking or locking sensation. As the person is moving, you are hearing some funny sounds out of the hip. All right, that's all things you should watch out for. Then management option, physical therapy, where they try to strengthen and increase the mobility, stretching routines, imaging studies like MRI, x-rays, ultrasound to assess the joint strength. Then some medications like anti-inflammatory drugs just to handle, you know, the inflammation and all. So surgical intervention in severe or structural cases.